House. Bloomberg's Hans Nichols is standing by. So, Hans, you heard the speech. What do you think were the most salient points?
Well, I think the actual forum was the most important point here. The president going to Chicago to address the doctors on their turf. And notice what his message was. His message was, I'm here to help. We're in this together, but I'm going to need your help as well. What he's offering the doctors, as you said, he's offering them a chance to be something more than bean counters or paper pushers, a chance to stop practicing defensive medicine. But he's expecting something in return. And what he's expecting is to alter the pay structures and also the outcome structures, the way health care is delivered. That might mean a reduction in pay for doctors. He certainly got their attention when he talked about stop the bundling of payments and have more outcomes results payments structures in place for doctors.
Hans, we thank you very much. Hans Nichols, he's going to be with us throughout the afternoon from the White House there. Sheryl Skolnick is Senior Vice President and Healthcare Services Analyst at CRT Capital Group. She is joining us now from Stamford, Connecticut, with her reaction to today's speech. Sheryl, glad to have you on board. I don't know if you just heard our reporter there at the White House, Hans Nichols, talking about the fact that the president was able to get the attention of those doctors in the room at the AMA. Was there anything that stuck out to you in particular as, okay, this is a highlight of something we're going to hear about?
Well, there were a number of things that stuck out to me. It was a very interesting speech. It was a speech that, quite frankly, I wonder whether or not he's been reading some of my research reports. It was entirely in concert with what I had anticipated the president would be saying. So let me hit the highlights. First of all, if you have money, we want it, we need it, it will pay for reform. That's number one. Number two, there are no sacred cows. Everyone will have to contribute in some way, shape, or form to making their efforts in delivery and payment of health care more efficient and more effective, more importantly. The third thing is that I heard very clearly was that there will be cuts before there are coverage. And that's because we're doing a number of things simultaneously. We're trying to address the cost of a very inefficient healthcare system. We're trying to address the need to raise funds to pay for changes to health insurance programs throughout the nation, and that are very dramatic and also very expensive. So that one of the resounding themes that I have been concerned about and that I certainly heard was, yes, there will be cuts, but the cuts will come likely before the coverage because of these competing needs. And then finally, there's the good old government standby. The devil is in the details. But what I also heard was a very firm commitment to changing the way in which health insurance companies operate, so that those folks who haven't been listening, I think, need to sit up and listen to that health insurance companies will not be allowed unfettered access to 47 million new lives.
So you think he is going to lead a crackdown then, even in Washington, on some of the lobbyists? They're going to hit harder brick walls, if you like, from the insurance group.
Well, I think certainly at the White House and likely in the House of Representatives itself, those walls have already been established, and if not, they just got higher and are quite formidable. The Senate is really the battleground for the lobbying interests right now, because it's the Senate Finance Committee who we expect will craft the legislation that will be bipartisan enough to actually be passed by the House. By the Senate Republicans, and then it will go to, of course, to conference committee with the House, where there'll be yet another argument where those demands, those programs that we just heard the president so eloquently outline, I think will be the starting point for the House of Representative negotiators. It's going to be a very tough battle, and I don't envy the lobbyists their jobs when the president stands up and says this is a plan that doesn't work.
Sheryl, we thank you so much. Sheryl Skolnick of the Capital Group.